Well, hello and welcome to Lecture 16. This is Ward Stevens, and the topic for this lecture is for-profit versus nonprofit. And I hope to answer the question somewhat of, does it matter? Now, when we think of healthcare and money, sometimes we have concerns. If I were to ask you what concerns you might have about nonprofit healthcare organizations, often I hear very few. Sometimes, most of the time, actually, don't hear anything at all. However, if I was to ask the question, what concerns do you have about for-profit healthcare organizations? Often I will receive comments such as putting profits before patients and that type of thing. So for this presentation, I have 9 learning objectives. Please take a few moments to look at those, as that's what you are expected to know and what you will be tested on. So let's start off. What do we mean by nonprofit? And second thing that we'll address here on this slide is just recognizing tax-exempt purposes. So what does nonprofit mean? It is simply a designation from the Internal Revenue Service. The technical reference for it is Section 501c3 of the Internal Revenue Code. So if you've ever given money to an organization and wanted to claim it on your taxes, you might not have ever done that yet, but perhaps sometime in the future you'll want to. You can only claim a deduction if this organization is a 501c3 organization. Now, there are a couple of other designations out there as well. However, this is the most popular. Now, in order to be a nonprofit, as determined by the IRS, the organization has to operate for exempt purposes. And those include charitable, religious, educational, scientific, literary, public safety, amateur sports, and preventing cruelty to children and also preventing cruelty to animals. And there are other things out there as well. So how do nonprofit hospitals fit into this? They fit into the category of being about providing charitable purposes. And specifically, they provide relief to the poor by providing care at little or no cost to the poor population. Historically, many of these organizations have been religious, primarily Catholic, Baptist, Methodist, Lutheran, some Presbyterian. Today, you really can't necessarily tell by the organization's name whether they were historically religious or not. In Monroe, Louisiana, St. Francis Medical Center is pretty obviously Catholic. There are some hospitals that still have Baptist in their name, but many of them have adopted corporate names such as Ascension Health, which is a large Catholic system. But not all are religious. There have been other organizations that also operate non-for-profit hospitals. Now, what's the difference between nonprofit and for-profit? Well, the differences lie in 3 areas. The first, in regard to taxes, which is related to their IRS designation. A second is that nonprofits have to demonstrate community benefit, which we will talk about. And then a third difference is financing. So what is the big advantage of being nonprofit? And the biggest one is financial, in that there are no taxes paid on earnings related to charitable purposes. So whatever the operating margin and the total margin of a nonprofit is, assuming that all of it is for charitable purposes, they pay no taxes. So big difference number 1 is they don't pay taxes on income from charitable purposes. And this is worth quite a bit. In 2020, nonprofit hospitals essentially avoided paying $28 billion in taxes. And in comparison, for-profits have to pay taxes. So the Hospital Corporation of America, the largest for-profit health system in the United States, pays taxes. as do the others. And so another way to look at it is maybe you might want to change the nomenclature. Is it better to say that one is non-tax paying and tax paying? Personally, I think so, because one time I worked for one of those tax paying organizations, and I've also worked for the non-tax paying as well. But the nonprofits like to call themselves nonprofits. It sounds nicer, but that's my opinion. On a previous slide, I shared that the value of the tax exemption in 2020 for the nonprofit hospitals was approximately $28 billion. But what this graph from the Kaiser Family Foundation reports is that the estimated charity cost was only about $16 billion, meaning that they essentially received $28 billion in tax breaks, but only returned $16 billion in value. And so it has became an issue in Congress that if we are going to provide these hospitals tax breaks, then the government, not necessarily the government, but the people represented by the government should also benefit from those tax breaks. So that leads to a second big difference, and that is that non-tax paying hospitals must demonstrate what is known as community benefit. And the community benefit requires them to provide and report the charity care discounted services that they provide to qualified patients. They have to participate in the Medicare and Medicaid programs. They can also count their investment in medical education and research, and then being involved in the community by doing things such as health screenings, as well as contributions that they may make to other nonprofit organizations. And then they can invest in what is known as community building activities. With the passage of the Patient Protection and Affordable Care Act of 2010, nonprofit hospitals are also required to do several other things in order to show their community benefit. One of those is that they need to do a community needs assessment every 3 years. And what this requires them to do is to seek broad community input. They are often going to talk to government leaders. They will talk to other nonprofit organizations, to healthcare providers in the community in order to implement strategies that will address barriers to care and help to prevent illness. In a county not too far from here, the community needs assessment was conducted, and this is pretty consistent with a lot of rural areas, that one of the biggest issues at this time is how to address the opioid epidemic, and also other drugs as well. And what can the health system do to try to prevent it from happening, and also to care for those individuals when they do become ill. Now, these reports must be made publicly available, and I'll show you some examples of those in just a moment. In addition, they are required to have written financial assistance policies, and part of that is that they can only bill eligible patients the same amount billed to insured patients. Now, historically, if a non-paying patient, one that did not have insurance, showed up to the hospital and they incurred charges of, say, $10,000, the patient would be expected to pay $10,000, or the health system or the hospital would take them to court. Taking somebody to court, frankly, often who had no way of ever being able to pay those bills. In fact, in a nearby city where I used to work, there used to be a day down at the local courthouse, which was known as the health system, their name, day in court, because everybody that showed up on this day was being pursued because they had not paid their bills to the health system there locally. So, but What this requires is that if the hospital is giving, say, an average 40% discount to those who have insurance, and you may remember from a current lecture that we have allowable charges, and then we have the what is actually paid after the discount. And if you are insured, all of what you owe is based on the discount that the insurance company negotiated with the hospital. And so all of these things are required. Now, before I move on, these are things that are just not just kept within the nonprofit sector. You know, the for-profit health systems do many of the same things. Though you may not be able to see their community needs assessment, they're not required to do that. They certainly have strategic plans, but their written financial assistance policies, and many of them do not have extraordinary collection actions, are very similar and very generous in my experience, and often sometimes more generous than those offered by nonprofit organizations. So a lot, in fact, the Hospital Corporation of America implemented financial assistance policies before 2010. So a lot of hospitals already had this in place, and some of them were for profit, some of them were not for profit. So here's an example of a community needs assessment for Atmore Community Hospital, and that is a nonprofit hospital down in Alabama back in 2022. 3 years, we'll have to do another one in 2025. And then over in Gadsden, Alabama, Gadsden Regional Medical Center does provide a community benefit report as well. It doesn't necessarily include everything in it that you would see in the one from Atmore, but Gadsden Regional Medical Center is owned by a for-profit company called Community Health Systems. So both types of organizations are reporting the benefits that they provide. Then a third big difference is their financing. The non-tax paying or the nonprofits usually raise funds to implement, to do new building projects out of two sources. One is tax exempt bonds, and I'll explain what those are in just a moment, and out of their earnings. Whereas tax paying or for profit hospitals typically will raise funds from the stock market, the New York Stock Exchange, for example, and earnings as well. So nonprofit hospitals typically rely on issuing bonds to fund things like building expansions. And a bond is simply a long-term interest-bearing note, which is secured by a lien on the borrower's property. So an individual would buy a bond, say, I'll buy one bond for $1,000, and I expect to get my money back over a defined period of time with a 5% return or whatever the return is for that particular instrument. And so it's it's actually, if you are an investor, they can be pretty safe as long as um, the borrower, the entity that issued the bonds, is strong and is able to pay it back. So, but ultimately, the bondholder expects to be paid. A stock and is a primary route that's used for-profit organizations. Now, for-profit organizations can also issue bonds. The difference is that if a bond is issued by a nonprofit, the person who pays or purchases or buys that bond is not required to pay taxes on the earnings from that bond if it's from a nonprofit. Whereas if they acquire a bond from a for-profit organization, then they would have to pay stock or pay taxes on those earnings. And so stock is essentially a portion of a company's capital represented by shares. And if you have, and hopefully one day you'll be able to, if you haven't already, I know many of you hadn't, you invest in a mutual fund or whatever. The mutual fund is investing in invest on your behalf and buy shares of stock in various companies, which essentially makes you a owner of that company, even though you might be a very, 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 very small owner, unless you're um, somebody like, I'm just forgetting that guy's name. But anyway, it doesn't matter. But as a shareholder, what you expect is that the value of your shares will increase over time, and that's kind of where you plan to make your money. I buy a share of stock today for $10. I'm hoping that the company will grow, and perhaps the shares might be worth $100 in a few years. Many years ago, my father bought 200 shares in Apple stock at a very nice price, and it doubled in value or something like that, and he sold it. If he had kept those shares, and I'm not sure exactly how many he bought, he would have been done very, 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 very well. But he sold it. His bad. But if you were an early investor in Apple and held on to those shares, you'd be retired. The shareholders also might expect dividends. And dividends are payments that are made by a for-profit company to those who hold shares. It's based on the earnings that the company had, and they usually pay out a certain amount per share. And it might be a 25 cents per share or $1.25 per share, whatever it is. I have stock in a small local bank in another county where I lived a number of years ago, and bought 200 shares. And about every year I get a check for them for about $120. And I still own the stock, and it has grown in value. So not getting rich off of it, but as you age and you want to be more conservative in your portfolio, you might want to look at stocks that provide some dividends. So ultimately, though, uh, there's a similarity. Okay, different sources of funding. The similarity is that both are beholden to outside investors. Bonds, again, they're more consistent, and over time. With stocks, if you are working for a for-profit healthcare company, there are a lot of pressures regarding quarterly earnings, because in the stock market you're pretty much getting evaluated every quarter, and it's based on what you did this quarter. It can make the stock go up and down. And my advice is, if you decide to invest, don't look at it very often. It'll drive you crazy, but you probably will, so that's okay. All right, so I want to define profit and margin, and also talk about why profit and margin are required. Now, profit is pretty simple. You bring in your revenues based on the services that you provided. You take out your expenses. That is your profit, and it's measured in dollars. And then another term that is often used is margin. And your margin is a percent of the revenue retained after the expenses. So if I have $10 left of $100 in revenue, my margin is 10%. So you may want to ask yourself, can a hospital not make a profit? And I think Sister Irene Krauss, she was the first female chair of the American Hospital Association, wisely said a long time ago, No margin, no mission, right? If your household consistently spends more than it brings in, it's very possible, and assuming nobody is going to come in and help you, that you would have no house. So why is a profit or margin required? One is you have to be able to buy the new stuff to provide state-of-the-art care. If you are in a, say, a small community hospital and your margin is next to nothing and you cannot buy yourself a robotic Da Vinci machine to do surgery, you may find yourself not doing very many surgeries. The CEO of our local hospital told me about just a couple of years ago that, yeah, he had to buy 2 Da Vinci machines. Why? Because if he didn't, he couldn't find surgeons who would be willing to work there. And second, because many patients expect to have that latest technology. And he also added that just the fact that you have all this sophisticated equipment and you can do robotic surgery doesn't mean that the insurance company is going to pay you 1 nickel more for doing the exact same thing. Another is that you have to have a margin so that you can remain competitive. Again, so you can be state of the art, maintain your facilities and so on. And you also want to have money for a rainy day because the healthcare industry goes up and down. When I worked in the hospital, we made most of our money during January, February, March, and April, primarily when people had the flu or pneumonia. It's also the time of year when people want to come in and have their surgeries. It's also the time of year when orthopedic surgeons do a lot of repairs to broken bones. But then you get into the summertime and the business goes down and you have to have the money. Actually, that might be for rainy and sunny days. But you can't always assume in healthcare that your business is going to remain consistent over time. And then you also, if you are going to grow and you are either whether you're a for-profit company or a nonprofit, you want people to invest in your stocks and bonds. Nobody's going to invest in your stocks and provide you the money that you need or the capital that you need to grow your business if they don't think they're going to get a return on it. And the exact same thing is true for bonds. And then it also demonstrates good stewardship of resources. Organization that just continues to lose money, sometimes maybe you can't help it because of certain situations, but it suggests sometimes that maybe you're not spending or using the resources that you have as well as you should. So what type of margins are hospitals making? This is from late December 2023, and in Becker's hospital CFO report, reported margins from a minus 10.6% to 11.1% for 34 health systems. And so you may, I wanted to ask the question, I thought it'd be interesting to look at, are the systems that are making money for profit or nonprofit? And I only looked at the first 10. But from an operating margin standpoint, and again, that's the a percentage earnings, Tenet Healthcare, HCA, and Universal Health Services, all for-profit systems, were the top 3 in terms of operating margin. And then there was a Mayo Clinic. Everybody, I think, has heard of that, as well as Stanford Health out in California. And then another for-profit community health systems. And then the following 4 are all nonprofit health systems. So, it looks like the for-profit systems are making a little bit more on the operating side of the business. Now, having said all that, I also want to point out that there's a non-operating margin, and the non-operating margin is related to services that are not related to providing healthcare. And if you add the non-operating margin to places like Stanford and Mayo and Christus and Northwestern, it would most likely increase them and make them a little more competitive, or have it, results closer to that you see in your for-profit healthcare systems. So those are the main differences: how they are financed, their community benefit, and their tax status. Now, just kind of look at the characteristics, just so you know what the breakdown is between for-profit and nonprofit hospitals. And they're really, I'm going to look at all hospitals, then just look at community hospitals, and then just give two examples of how things might differ between states such as Virginia and Alabama. So in 2021, there were roughly 6,100 hospitals in the United States, and about 20.2% of those were for profit, and about 49% were nonprofit. You also have a relatively sizable number, close to 950, that are owned by state and local governments. There are also federal government hospitals. That would be your Veterans Administration and others. And so between the two, the for-profit and nonprofit, about 69% of hospitals in the United States. Now, many of you, and probably most of you, will work for community hospitals. So roughly 5,100 of those in 2021. And you can see that the percentage of this set for nonprofit increases up to roughly 58% and about 24% for profit. So how do things look in Virginia? In Virginia, we have about 85 hospitals. You would think that I could come up with exact number for that, but it's a little bit hard because the way things are counted. You can have two hospitals that report as one hospital, so it makes it a little bit hard. But in Virginia, the bulk of the hospitals are still nonprofit, about 80%, with the remaining 20% being for profit. And that's for your community-based hospitals. And in Alabama, a little fewer percentage of nonprofit hospitals, 67%, and 33% for your for-profit hospitals, being about 102 hospitals in total. So I'll spend a few moments talking about the impact of tax status on quality and management. Or maybe a better way to say that is, what is the relationship, if any, between tax status and on quality and management? And according to the folks up at George Washington University, there's no indication of any difference in the environment, operational efficiency, or standard of care between nonprofit and for-profit hospitals. And there's no reason to believe that the quality and management of a hospital correlates to its tax status. But you might want to ask yourself, as a future healthcare professional, should I be concerned about the quality of care at for-profit hospitals? And I would go on to say, well, you should be concerned about the quality of care at 4 hospitals. Tax status alone is not going to help you make a good decision. So that's just a restatement of what I just previously read. So, and related to that, 3 times the charm, I guess. But how can you evaluate hospital performance? And there are several things out there that you can use. One is known as leapfrog.org. If you are in a state such as Virginia, we have this entity called Virginia Health Information, which provides a lot of good information. A lot of it is pulled from Hospital Compare, which is available online as well. And then the Joint Commission, which is an accrediting body, which I'll talk about, is also a good source of information. So let's talk about Leapfrog. Leapfrog is a nonprofit they describe themselves as a watchdog organization. And what it does is that it assigns letter grades to U.S. general hospitals. About 3,000. We know that there are a lot more than 3,000, but 3,000 participate. They do not provide a grade if a sample size is not significant enough. And you need to remember that some hospitals report jointly. And I mentioned that before, but all hospitals, here's the little technical side of it. All hospitals have this thing called a Medicare provider number. And it is used in what they put on their report so they can get paid by Medicare. And sometimes hospitals that are part of the same system will use the same number. At one time they had two numbers, and then they have one number. And so sometimes it might be hard to find something about a very specific location. And then there are a good number of hospitals that do not report. And there's information on other organizations such as ambulatory surgery centers as well. So what the Leapfrog looks at are 30 performance measures that they obtain from CMS. So you could go to the Healthcare Compare site and find the same information. And they look at two domains which are equally weighted. They will look at process and structural measures. For example, how often a recommended treatment is provided. An example of that might be, though I'm not sure this is the recommended treatment at this time, whether a patient receives an aspirin when they come to an ER if they've had a heart attack. Or another process issue is, are the doctors ordering medications through a computer system? And then they also look at outcomes such as retained foreign bodies following surgery or hospital-acquired infections and so on. So that's the criteria they look at. And when you look at state results, the states that have the most A hospitals are New Hampshire, Virginia, and you can see the list that is there. And then there's some locations that have no A hospitals, the District of Columbia, North Dakota, and Vermont. So how do for-profit hospitals in Virginia compare to their nonprofit peers according to the Leapfrog quality grades? For-profits represent about 25% of the graded Virginia hospitals. You can see in the third column from the right that there were 18 that participated in the survey. And so let's look at the A grade. 37 hospitals in Virginia received an A. 11 of those were for-profit. So they represented roughly 30% of the A grades, which is higher than the percentage of graded hospitals, or higher than their percentage of all hospitals in Virginia. And as a percent of for-profit hospitals, 61% of those 11 received an A, compared to the Virginia nonprofits where it was 49%. So, you look at Virginia, they're doing pretty well. I will also note that a for-profit also received the only D within the state. So kind of at both extremes. But overall, when I look at this information and compare it even nationally, the for-profit hospitals seem to be doing okay. Now, if we go down to Alabama, Alabama for-profits represented roughly 26% of Alabama's graded hospitals, and seven hospitals in Alabama received an A. So the for-profits earned 42% of it, 43%, which is higher than their percentage of graded hospitals. But only 18% or 19% of the for-profit hospitals, as a percent of for-profit hospitals of 16, actually made the grade. So a lower portion of their hospitals, but still higher than the percent of Alabama nonprofit hospitals. So kind of similar results, I think, to what we saw in Virginia. So some examples from Alabama. University Hospital, big place down in Mobile, in the spring of 2023, earned earned a D. So oftentimes physicians think that, if you want the best care, you got to go to the university hospital. Here in Virginia, it's always about the University of Virginia or Virginia Commonwealth University. And in some university settings, that may be true. But just because university has, something has university in front of its name, or that it's affiliated, doesn't necessarily mean that they're providing the highest quality care. And also, there are other things that you can look at, and this is just an example of some of the reports that are out there. And for example, do they have effective leadership to prevent errors? Are they doing what they need to do to address the problem? And you can see that this hospital had some achievement, and you can see the other measures as well. But Leapfrog, I think, is a good place to go look. And if you are interviewing for a job, or you're considering going somewhere to be a patient, these are things you might want to take a look at. Another source of good information is the Joint Commission. They were founded in 1951 and established a voluntary accreditation service. And you don't have to participate in the Joint Commission if you are a hospital, but if you are accredited by them, you have what is known as deemed status with Medicare, which basically means that Medicare will pay. If you don't have deemed status from the Joint Commission, there are some other accreditation services out there. States can also provide deemed status. They will come in and do the inspections. And what deemed status, besides the fact that they will pay you for it, it means that the hospital meets the conditions of participation or the rules that Medicare has for hospitals. And they accredit about 22,000 different entities. Now, we only know there are 5,000 or 6,000 hospitals in the United States, so that's only probably 20-25% of what they do. But they also have accreditations for ambulatory surgery centers and other types of healthcare organizations. And it's pretty easy to find information online regarding a particular hospital. East Alabama Healthcare Authority, which is a government entity actually, operates the hospital there in Opelika, Alabama, which is near our Auburn campus. And you can go there and check at qualitycheck.org and find out whether they are accredited or not. And you can see that by their name. This was from the Joint Commission website, that they've got that gold seal. That's a good sign. So some other things that they certify, I mentioned ambulatory surgery centers, but they also certify inpatient diabetes programs, stroke centers, and others. And these are the results from East Alabama Medical Center. So here's some information on two hospitals, both of them here in Virginia, and one is for profit and one is not for profit. And what I'd like to ask you is, can you tell the difference between which one is for profit and which one is non for profit? You can see the Medicare ratings in the first two rows at the top. Hospital B is performing better. The next line down, they have a higher patient satisfaction, also a higher Leapfrog grade. Overall efficiency, though, Hospital A is there. Their costs are essentially the same. Their net revenue per adjusted admission, don't worry what that measure is, it is one. Really isn't that much off. you can see that the charity care and bad debt and taxes is significantly higher at Hospital A, Hospital B. Hospital A has a higher uh, um, Medicaid participation and but a lower in total margin. Hospital B, 26%. The total margin at Hospital A being 14%. And they're both teaching hospitals. Can you look at that information and determine which one is for profit and which one is not? Now, the typical answer, if I was doing this and you were sitting in a classroom and I asked the class this question, many of them would say that Hospital B is the for-profit hospital. Primarily looking at numbers at like that total margin. Man, that's a great return. You remember the health system ones I showed before. I mean, HCA's and Tenet Healthcare were 10 and 11% on their margins. And they look at Medicaid participation. Well, for Hospital B, that's significantly lower than the other one. And then the taxes are and bad debt and charity are much higher for Hospital A. But most time the class will say Hospital A is your non-profit. They're doing more charity care. Their margin is lower. Hospital B are those evil for-profit people. The fact of the matter is, Hospital B is the non-profit hospital. So, but regarding that, and I look at all that, I think I might prefer to go to Hospital B. But so you can't necessarily just look at what their costs, their margins are, their charity, bad debt, and taxes, and so on. And then here's another pair of hospitals. Again, both of them are here in Virginia. And the Medicare Star rating is a little better for Hospital A. Patient satisfaction's about the same. Hospital A has a grade with Leapfrog, Hospital B a C. Hospital A is more efficient. Their costs are way lower. Their net revenue though is lower, and their bad debt and taxes and charity is significantly higher. Medicaid participation about the same. Total margin is higher, and they're both teaching hospitals. And again, a lot of times, classes I think look at the charity, bad debt, and taxes and go Hospital A must be the non-profit. Hospital A has lower revenue, net revenue per adjusted admission. That must be the non-profit. But as in the previous example, the for-profit hospital is column or hospital A. So it's really kind of hard to tell, hard to choose. So I think a takeaway from this is that overall nonprofit and for-profits operate in similar fashions. They can have similar qualities, provide similar quality care. They provide business in similar ways. But there are differences between hospitals. And if you want to choose the best hospital, you need to not make your decision necessarily on their tax status, whether they're for profit or not, and research it and make the best choice that you have. So thanks for listening, and please contact me if you have any questions.